My name is Kaleche Kasina. I'm a wife, a mother of 3 children, and I'm a mother of 3. Yes. I worked in KBC, and when I learned the ropes, I came out so that I could do what I am doing now. I was the health editor. That's where my passion for telling health stories came. I covered Anyang' Nyong'o's return from America. And I'd like to do a follow-up on the same. Just basically any health story, name it, hair, skin, that's what I'm interested in doing. I have a health channel called Kaleke's Health Moments, and I'm going to post this there so that other people can also watch it and learn. Our tagline is living healthy one story at a time. So now, without much further ado, we are going to let each and everybody introduce themselves. We can start with you, Apondi.
Thank you so much.
Yeah.
My name is Apondi Nyangaya, and I'm a homemaker. And in my free time, I'm a social development consultant,
Okay.
a partner, and a grandmother.
Okay.
I think that in a nutshell is for this platform, as much of an introduction as I'll make of myself. I wear very many hats.
Yes, I know.
People who are grandmothers would be having very many hats on,
yes,
so they have to choose which one to bring out at any given time. Yes.
Okay, thank you, Apondi. Dr. Peter?
Yeah. I'm a pediatric surgeon at the University of Nairobi. I'm a lecturer actually at the university where I train undergraduate students who are taking their medicine course, and also the MPESA or the master student who are preparing for their masters in pediatric surgery. However, I work for most of the hospitals within Nairobi and also pro bono for a number of counties, specifically Coast General Hospital, Mombasa, that's Mombasa, then Meru and Embu as well. So in a nutshell, I'm also a father. I have 2 boys, one who is 10, the other one who is 6 years old. And my passion has always been children, pediatric surgery specifically. Thank you.
Thank you very much for that intro. Perhaps we can start with you, Dr. Mwika. You can just tell us who a pediatric surgeon is. A pediatric, okay. Yes.
Pediatric surgeon. Yeah, depending on the country that you are in, the definition of the scope of a pediatric surgeon changes. There are countries where pediatric surgeons operate on anyone less than 18 years. For this country specifically, we go up to around 13 to 15 years. In some countries, you are aware that pediatric surgeons actually do what you call fetal surgery, the ability to operate fetuses before they are even born. That is within the scope of pediatric surgery. However, in this country, we have gone out there to see, but you haven't started fetal surgery because of definitely the infrastructure around and the logistics of doing it. But basically, we are the people who wait for those neonates who need surgery on day 1 and they are done a diagnosis before, or children who need emergency surgery even within the first hour of their life to the age of 15 years. So we mainly deal with surgical conditions that involve children. And there are other subspecialties within pediatric surgery. There are subspecialties in neurosurgery, subspecialties in urology, those who deal with the kidney, the ureter, bladder, the urethra, and the rest. There are also subspecialties in cardiothoracic surgery amongst the pediatric surgeons. However, in this country, we are very few. We are actually the ones who are registered. If you check from our board, most of us are in Nairobi. We have 1 in Eldoret and 3 in Kisumu. So most of our counties in this country are not covered. And the ones who are in Nairobi, mainly in Kenyatta National Hospital or the University of Nairobi, pretty like cover the bulk of the work. However, the adult surgeons in their training at the University of Nairobi, they are also trained in pediatric surgery. So apart from operating on adults in the counties where pediatric surgeons are not there, they operate on the simple cases of pediatric surgery. The rest that they can't handle in the counties, then they refer to Nairobi. I hope I have not over-explained myself.
You've explained yourself very well, Daktari Apondi. You can feel free to ask any questions along the way. So what I've heard from you, Daktari, is that you think that there's an uneven distribution of these doctors, eh? Okay, I'll give you a question towards the tail end of the discussion about that. Now, before you tell us about the procedures that you take your patients through, are there any misconceptions that you'd like to demystify about pediatric surgeons? Okay, there's one I gave you when I gave you a call. You know, people imagine you're running around the wards wearing a SpongeBob t-shirt or hat, you know, and giggling and playing with the kids. Is that so?
I think it's a yes and no. You, as much as possible, try to connect to your patients, and children behave in different ways. Some you have seen when they come even for hospital visits, they are unlikely to sit still, and yet you still have to examine, you still have to talk to them. So some move around. So sometimes you also move around trying to examine and to also get their part of the story. We don't necessarily have to force them to stay in a coach as we examine. There are some things you can pick as even the children play and as they walk. It's the easiest way to connect with them. However, the first misconception I think I would want to clear from the beginning is the way most of us take children as small adults. They are not. I think children are children and they have different aspects about them, and they're supposed to be managed as just pediatrics, not small adults. So right from the dosing for treatments or even the way you communicate to them, they are completely different type. And one has to understand that type to connect with them, to examine them, and to be able to treat them. I think that's the main thing I would want to clear.